Okay, we need to have a serious conversation. And I need you to listen carefully because what I'm about to tell you isn't making the headlines, but it absolutely should be. Depending on when you're listening to this, you're down to a matter of weeks. You see, Medicare open enrollment closes on December the 7th. And while everyone is talking about the big changes, the premium increases, the shrinking networks, the disappearing drug plans, these are some other changes that are happening too that almost nobody is talking about. And these hidden changes, they could cost you just as much, if not more, than the ones that everybody else is panicking over. Welcome to the Retirement Learning Lab. I'm Van Richards, and today I'm pulling back the curtain on Medicare 2026 changes that insurance companies are hoping that you won't notice. The ones that aren't in the marketing materials, the ones that your broker might not even know about. Before we dive in, if you've listened to me before, you know the drill. Everything that we're talking about today, it's educational. This is not medical, legal, or financial advice. I'm here to help you understand what's really happening so that you can make informed decisions about your healthcare coverage. For more details on the limitations of this information, please stay tuned until the end of today's broadcast for more information. So here's where we are. It's November. Open enrollment started October 15th, and it ends absolutely on December the 7th. That means that right now, depending on when you're watching this, you've got just a matter of weeks that are left to make one of the most important financial decisions of your retirement. Just a matter of weeks. Now, I know some of you were thinking, Van, I've already heard about the Medicare changes. I've seen the videos. I get it. Costs are going up. Networks are shrinking. What else is there? And that's exactly what I want to talk to you about today. Because while everybody else has their hair on fire over the obvious changes, and yes, these are important, there are some changes that are happening in the fine print that could blindside you. I'm going to walk you through 7 changes that almost nobody is talking about. And then I'm going to tell you exactly what you can do about them before time runs out. But first, let me tell you why I created something that'll help you with all of this. Because frankly, this is too much for anyone to keep track of on their own. I've put together a comprehensive resource that's called the Medicare 2026 Survival Guide. And I'm giving it away absolutely free, no strings attached. Medicare.retirementlearninglab.com. That's where you'll find it. Now, this isn't some sales pitch. It's a complete guide with checklists, worksheets, comparison tools, and a week-by-week timeline that tells you exactly what to do between now and December the 7th. Over 1,000 people have already downloaded it, and they're using it right now to navigate some of these changes. And I'm going to reference it throughout today's broadcast because honestly, trying to remember all of this without a written guide is almost impossible. Now, you can grab it at Medicare.retirementlearninglab.com. I'll remind you a few more times, but go ahead and pause right now and download it if you want to, and you can follow along. Okay, listen up. The next 7 things I'm going to share with you, these are not optional to know. Now, if you're driving or you're cooking, that's fine, but stay with me if you would. These could cost you thousands of dollars if you miss them. Let's dive into these hidden changes. Here's hidden change number 1, the specialist referral maze. It's getting worse. Here's something that I've seen, but I don't think very many other people are talking about it. Many Medicare Advantage HMO plans are adding an extra layer of approval requirements for specialist visits. Here's what's happening. It used to be that you could get a referral from your primary care doctor and you could go see a specialist. Simple, right? But now, some plans are going to require what is called a utilization review before that you can see certain specialists. That means that even after your doctor refers you, the insurance company has to approve the appointment first. And here's the kicker. The review process can take anywhere in between 3 to 14 business days. That's 2 weeks before that you can even schedule your specialist appointment. Think about that, what it means if you have concerning symptoms that you need evaluated. Maybe you need to see a cardiologist or an orthopedic surgeon or a neurologist, which are almost impossible to get into in Houston. You're not just waiting anymore for an appointment. You're waiting for permission for the appointment. Now, they don't advertise this in big letters. It's usually buried somewhere on, let's say, page 47 of the evidence of coverage document. But it's there, and it's affecting more and more plans. How do you know how to find it if your plan has it? Well, there's a specific section in your annual notice of change that mentions, get this, prior authorization requirements. Now, in the Medicare 2026 Survival Guide, I've included a checklist of exactly what to look for and what questions to ask about this. Now, you can get that at medicare.retirementlearninglab.com. Okay, you ready for hidden change number 2? The shrinking therapy cap. Nobody mentions this. Here's one that's flying under the radar quite a bit. Physical therapy, occupational therapy, speech therapy, these are benefits that are being quietly reduced in a lot of plans. Now, Medicare covers these therapies, but Medicare Advantage plans can set their own limitations within certain guidelines. And for 2026, a lot of plans are cutting back. Some plans that used to cover 60 physical therapy visits are cutting it down to 30 or 40. Others are adding higher copays after the first 10 visits. Okay, this is what that means, and I need you to really hear this next part, especially if your spouse or you have upcoming surgeries. Why does this matter? Because if you have a hip replacement or a knee replacement, or heaven forbid, a stroke or any other serious injury that you need physical therapy, it's not an optional. It's essential for your recovery. Let me give you a real example. I talked to someone whose plan covered physical therapy at $20 per visit. That's pretty reasonable, right? Well, for 2026, their new plan structure is $20 for the first 12 visits, then $75 for every visit thereafter. Now, if you need 40 sessions of physical therapy, which is pretty common after a major surgery, that is, you're looking at an extra $2,100 out of pocket compared to what you paid last year, which was much less. And here's the sneaky part. The summary of benefits might just say physical therapy covered. It doesn't always spell out the visit limits, the tiered copay structure. You have to dig deeper into the evidence of coverage document, or better yet, if you use my checklist in the Medicare 2026 Survival Guide, you'll know exactly what to look for. Now remember, you can get that at medicare.retirementlearninglab.com. All right, here's change number 3. Emergency room costs are structured differently. Okay, now this would really surprise me when I discovered it. The way that some plans are billing emergency room visits is changing in a way that could cost you a lot more money. Traditionally, you had one copay for an emergency room visit. Maybe it was $90, $120, maybe even $250, depending upon your plan. But it was one flat fee. Now, some plans are switching to what they're calling a tiered emergency room copay. And it works like this. If you go to the ER and you're admitted to the hospital, your ER copay might be waived. That sounds good, right? But if you go to the ER and you are not admitted to the hospital, meaning they treat you and they send you home, you could be charged not just for the ER copay, but also separate copays for each service that you receive. X-ray, that's a copay. Blood work, another copay. CT scan, that's another copay. They're itemizing it now. So instead of that $150 ER copay, you might end up paying $150 plus $50 for the lab work plus $75 for the imaging. That's $275 instead of that $150. And here's the tricky part. The summary of benefits might just still say emergency room copay, $150. It might not mention the additional service fees. This is buried in the fine print, and it's affecting more and more plans than you might think about. How do you know if your plan has this structure? Now, there is a specific question that you need to ask, and I've included it in the guide along with the exact wording to use when you call your insurance company. You can get the guide at medicare.retirementlearninglab.com. Okay, here is hidden change number 4, the home health care cutbacks. All right, wait a minute. If you've tuned out for just a minute, I need you to come back to me. This next one is critical, especially if you're planning on staying in your own home as you age. Home health care benefits are being reduced in a lot of Medicare Advantage plans. Home health care, well, you know that. It's like when a nurse comes to your home, a therapist or an aide comes in to help you for care after a surgery, an illness, or an injury. Now, it's often really the difference between you staying in your own home or having to go to a skilled nursing facility. And for 2026, many of the plans are tightening their requirements for home health care approval, and some are actually reducing the number of visits that they're actually going to cover. Now, others are just going to require that you have extensive documentation from your doctor to prove that you really need it. Now, I've seen some plans use the approved home process pretty easily, but now they're going to have something that's called medical necessity reviews, even for basic services. Now, what does that mean? It means if you have a surgery, your doctor orders home health care. The insurance company might deny it, or they might approve it with fewer visits than your doctor actually recommended. And then what happens? You're stuck either paying out of your own pocket for those visits, and it could be an extra $100 or $200 a visit, or just trying to manage on your own. This is really important if you're trying to live alone, or if you have mobility issues, or if you're planning any kind of surgery in 2026. Now, the guide that I created has a section that specifically shows you how to evaluate home health care benefits and what questions to ask about coverage limits. It's all there at medicare.retirementlearninglab.com. All right, let's move on to hidden charge number 5, durable medical equipment cost. They're increasing. That's things like wheelchairs, walkers, hospital beds, oxygen equipment, nebulizers. These are the things that are necessary for illnesses or after surgeries. In 2026, these plans are changing. Some plans are switching from the DME at 20% coinsurance to requiring a flat copay per item. And depending on the equipment, that could be more expensive or less expensive. But here's the real issue. Some plans are now requiring that you use specific durable medical equipment suppliers, and those suppliers don't have everything that you need. If their equipment is also of lower quality, you're stuck. Let me give you an example. Let's say that you need a power wheelchair. Your plan might cover it at a 20% coinsurance, which, well, that sounds pretty good, right? But if they require that you use their contracted supplier and their supplier only has certain models that are available that don't give you any choices, and if you want a different model that better suits your home or your needs, you might have to pay the full cost out of your own pocket. Now, this is particularly important if you have progressive conditions like COPD, or if you're managing mobility issues, or if you anticipate needing any kind of medical equipment in the coming year. The good news is the checklist in the Medicare 2026 Survival Guide includes specific questions to ask about durable medical equipment coverage, your supplier networks, and what happens if the equipment that's not up to your standards is needed. You can download it at medicare.retirementlearninglab.com. All right, I know this is a lot. Let's go to number 6, mental health and behavioral changes. This is one that I think that deserves way more attention than it's actually getting. Mental health coverage, therapy counseling, psychiatric care. This is changing in some significant ways. First, many plans are reducing the number of in-network mental health providers, that is the psychiatrist and the therapist. A lot of them are actually dropping out of the Medicare Advantage networks because the reimbursement rates are way too low. Second, some plans are adding limits on the number of therapy sessions that they'll cover every year, or they're requiring prior authorization after a certain number of visits. And then third, and this is really concerning, some plans are pushing people toward telehealth for mental health services rather than in-person visits. Now, for some people that might be great. Telehealth can be great for some people, but it's not right for everybody. And it shouldn't be the only option that's covered at a reasonable cost. If you or your spouse are currently seeing a therapist or a psychiatrist, or if you might need mental health support in the coming year, you need to verify this coverage very carefully. Now, the guide that I created does include a specific section on mental health benefits and how to verify your providers. You can get it at medicare.retirementlearninglab.com. All right, we're going on to the last change, number 7, the preventive care redefinition. Okay, the last one, and honestly, this might be the most frustrating of all 7. So stay focused here because this affects everybody. Medicare covers certain preventative services at no cost to you. Things like annual wellness visits, cancer screenings, cardiovascular screenings, diabetes screenings. These are supposed to be free. But here's what some plans are doing. They're redefining what counts as preventive versus diagnostic. And here's an example. You go in for a free annual mammogram. That's preventative, right? So it's covered at no cost. But the radiologist sees something concerning it and orders additional imaging during the same visit. Suddenly, the additional imaging is now considered diagnostic, not preventative. And diagnostic, that's subject to another deductible and copays. So you went in thinking that you were getting a free screening and you walk out with a bill for $300 because they found something that needed to be looked at more closely. The same thing's happening with colonoscopies. The screening is free. But if they find and they remove a polyp during the procedure, which happens to a lot of people, some plans are actually billing them as therapeutic procedures rather than preventive care, and you're paying for it. This is crazy, and it's happening more and more. Now, the Medicare 2026 Survival Guide has a list of questions to ask before any preventive service to make sure that you understand what will and won't be covered. You can get it at medicare.retirementlearninglab.com. Okay, so those are 7 changes that almost nobody is talking about, but they're real, they're happening, And that could affect you. Now, you might be thinking to yourself, Van, this is overwhelming. How am I supposed to keep track of all of this? Well, you're right. It is overwhelming. And that's exactly why I created a guide, the Medicare 2026 Survival Guide. Because trying to remember all of these things, all of these details, trying to know what questions to ask, trying to compare plans while keeping all of this in mind is too much for anybody. So I'm giving you a system. The guide gives you that system. It's got the checklist, the worksheets, the questions to ask, and a week-by-week timeline. So you know exactly what to tackle first. And it's completely free. No credit card is required, no strings attached. You do have to give me your email, but I'm not going to spam you. Just go to medicare.retirementlearninglab.com and download it. Over 1,000 people have already grabbed it, and they're using it right now to navigate these changes. All right, this is where I need your full attention, so stop just a moment. Put down whatever else that you're doing for just 2 minutes, because I'm going to give you the exact steps to take. So here's what you need to do next over the next few weeks. Here's step number 1. Get the guide. Seriously, I've told you a lot of times because I think it's so important. Medicare.retirementlearninglab.com. It's going to make everything else so much easier. Step number 2. Read your annual notice of change with the checklist. You can get it at your insurance company. Don't just skim it. Actually read it with the checklist in hand. Look for specific things that I've mentioned today. The prior authorization requirements, the therapy visit limits, the emergency room billing structure, all of it. Step number 3. Call your doctor and your insurance company. Use the question scripts in the guide. Verify that your doctors are in the network. Ask about specialist referral requirements. Confirm your therapy benefits. Don't assume anything. Step number 4. Compare at least 3 plans. Even if you love your current plan, look at alternatives. Use the comparison worksheet in the guide to evaluate them side by side. And then step number 5, make your decision by December 1st. Don't wait until December the 7th. Give yourself a buffer in case you need to ask follow-up questions or you need to get additional help. All of these steps are laid out in detail in the guide, week by week, exactly what to do and when. Now, I know some of you are out there thinking, Van, I really don't have the time for this. Can't I just stick with what I've got? Look, I get it. November and December are really busy holiday months. You've got holidays coming up, family gatherings, a million other things that you could be doing. But here's the reality. The 10 hours, yes, 10, that you might invest now in reviewing your Medicare coverage could save you thousands of dollars and countless headaches in the next year. And if you don't do this now, you're stuck with whatever decision that you make or don't make for the entire year. There's no do-overs in March when you realize that your physical therapist isn't covered. There's no do-overs in June when you need to see a specialist and you're stuck with a 3-week approval process. The time to handle this is now. Others of you, well, you might be thinking, my insurance broker said that everything is fine on my current plan. Well, I have a secret for you. Maybe it is, but remember what I told you in my last video. If you haven't listened to that, go listen, because broker commissions have been cut on certain types of plans. They might not even be aware of some of these hidden changes, or they might not have an incentive to dig deep into the fine print. You have to take ownership of this decision. You're the one who's going to have to live with the consequences. And that's one of the reasons why I created the guide that I did, to give you the tools to verify everything for yourself, to do it on your own. You can get it at medicare.retirementlearninglab.com. Okay, stop what you're doing. I know I've said that a couple of moments. This deadline part is absolutely crucial. Here's what I need you to understand. We've got just a matter of weeks before this deadline. And I'm telling you right now, don't wait until the last week. Here's what happens in that last week of open enrollment, that is. The SHIP counselors, those are the counselors that are free, that can help you, they're overwhelmed. The Medicare helpline, your wait times are going to be 2 or 3 hours. Your insurance agents, they're going to be swamped and they can't give you the time that you need. Everyone waits until the last minute and then everyone panics at the same time. Don't be that person. Start this weekend. Download the guide at medicare.retirementlearninglab.com. Set aside a Saturday. Make it a priority because December 7th is coming really, really fast. The window closes and you're going to have to live with whatever that you've chosen for the next 12 months. You know, I think about this verse from Proverbs a lot because I read the Bible, and to each his own, but I want to share it with you because I think it really applies here. It's Proverbs 27:12, and it says this: "The prudent see danger and they take refuge, but the simple keep going and pay the penalty." Being prudent doesn't mean being paranoid. It means paying attention. It means doing your homework. It means not ignoring warning signs just because it's inconvenient or it's uncomfortable. I know it doesn't feel good to do some of this stuff. These hidden changes I've talked about today, they're real. They're happening. And being a good steward of your health and of your finances means taking the time to understand them and plan accordingly. That's what the guide is designed to help you to do, to be prudent, to see the full picture, to make wise decisions. All right, here we go. Final action steps. If you've been half listening up until now, tune back into me for just a minute. This is what you need to do as soon as this video ends. Okay, let's recap real quick. You need to do this right now. Number one, download that guide, that free Medicare 2026 survival guide at medicare.retirementlearninglab.com. Number two, block time this coming weekend to go through the checklist. Number three, make your calls to your doctors and your insurance companies next week. Number four, compare plans in the following week. Number five, make your final decision by December the 1st. You've got just weeks to go. That's enough time even if you start now. It's not enough time if you wait until the last week. The guide has everything that you need, the checklist, the worksheets, the question scripts, and the timeline, and it's completely free. Over 1,000 people have already downloaded it. Join them. Go to medicare.retirementlearninglab.com right now and get your copy. Now, if you found this helpful, please subscribe and hit the bell icon. Share this video with anyone that you know who's on Medicare. These hidden changes are affecting millions of people, and most of them have no idea. Drop me a comment below. Let me know which of these 7 changes surprised you the most. Or if you discovered another hidden change that I didn't mention, share it in the comments so that we can all learn from each other. I'm Van Richards, and thank you for joining me on the Retirement Learning Lab. Now go do your homework. Download the guide. You've got weeks to go. Make them count.